Health, Home, and Lifestyle. Presented by Paradise Fitness Center, changing lives since 1996.
Hello today and welcome back to Health, Home, and Lifestyle. I'm here in studio with Senator Aline Yamashita and breastfeeding coordinator Adelina Portela to talk about breastfeeding in the workplace. So for all those mothers out there who, or even employers who aren't too familiar of what the law says, can you tell us a little bit about the law that you put into place?
Yes, thanks, Isa. Well, this was a response to moms who stepped forward and said, you know, I'm so excited I'm a mom and I'm so thrilled and breastfeeding is hard, but I'm doing it, but I have to go back to work. And so there was concern about, well, what's going to happen when I go back to work? And so Addie got a lot of community stakeholders together. We had many roundtable conversations. And in the end, Nanas and Patkun Act was written and passed, and the implementation is what Adelina does, and that's really a tough part. What we found was that when mothers went back, when they had to breastfeed, when the milk is ready to expel, it just happens. I mean, you can't control it. But more often than not, they found themselves in the toilets. There was no place for them to go that was private, that was clean. So many of them said they had to go to where the toilets were. And I thought, well, you know, we can do better than that. And then some others talked about being penalized because they got up from their desks. Now, some employers are very good with them being able to express at their desk, but more often than not, privacy is the rule, right? So this rule, this law looked at saying that there shall not be any penalty or discrimination for a mom who returns to the work site and continues to breastfeed, and that all government agencies shall provide a place on the work site that's close to where the mothers work, that is clean and that is safe, and that it should run as much as possible during their break time. However, Isa, if a mom, and those out there who breastfeed right now, we know that when the milk starts to leak, the milk starts to leak. I mean, that's what happens. So if a mom needs another break period, that she shall be able to go and expel the milk. So that's what this law does. It says to our government agencies, this is what shall happen. And the Department of Administration, through the good work of Adelina and Alex and Charlie and Rose Zabala, they developed operational policy 15-019 that says exactly that, but tells the departments that this is what you need to be able to do. If there is any harassment or penalty, they're supposed to be able to file with the Department of Labor. And what I do know is like the Guam International Airport, they have a family room where travelers are able to do that. Of course, the Department of Public Health Social Services has their room. Guam Memorial Hospital in their expansion plans is going to have a room. So that's what this law says, that if a mom wants to go back to work, and more often than not, moms need to go back to work. You got to pay the bills, right? So they go back to work, but they can still breastfeed and lower the cause of infections or respiratory diseases or even diabetes, cancer, and all of those types of issues. And, you know, when you find out you're pregnant, you're excited, then you're a little nervous, right? And then when you go through labor, you're like, oh, hold on, I can do this. But then actually when you have the baby, you know, it really is true. It's like you kind of forget all of that stuff. But then when your baby gets sick for the first time, or your child or your teenager, I think taking care of an unhealthy child is one of the most terrifying things. So if this prevents, if breastfeeding milk prevents, and it does, then this is something that's natural and that we should have. And so Governor Calvo signed it in 2013, full support of the Guam legislature, and it's a policy that's community driven and says to employers, our government agencies, this is what you shall do to support these moms and their babies.
And I think it's so important because a lot of women go back to work within the first few months, and you're actually supposed to breastfeed a lot longer. Can you tell us a little about that and what working mothers should know?
Well, the American Academy of Pediatrics recommend exclusive breastfeeding for 6 months to a year. But the law even provides up to 2 years. Yeah, and so the moms, when they go to work, well, we give them tips. One is you need to really have a birth plan. Talk to your doctor, talk to your employer, and tell them how you feel and what you have planned when your baby comes. And the next thing is we need to establish your milk production. That means you have to breastfeed before you go to work and store some milk, so that when you go back to work, you know, grandma or dad or auntie can feed the baby the breast milk in the bottle. But then when you go to work, One trick we tell my moms is to go to work in the middle week of your work week. So your first week to go to work, instead of going Monday to Friday, go start work Wednesday. So you're with your baby 2 days, and then you're off for another 2 days, and then the following week you can start on a Monday, so that you have that gradual adjustment between you and the baby. But the discussion between your employer and the mommy needs to happen so that it's more pleasant to go back to work. We have I've received several phone calls. Can you fax me the copy of the law? Can you go to my HR and send it over there? Can you email my boss that there's such a law? And we accommodate them. We also have moms that walked in our clinics and said, I'm going to jury duty and I'm exclusively breastfeeding. The clerk asked me to come and get certified that I'm breastfeeding. And so we give them that service so that they can be accommodated.
It's lovely.
Okay, so breastfeeding is difficult for any mother, especially when you're transitioning back into the workplace. And so it's a great news that there is this law in place to help mothers breastfeed throughout their work throughout the first 6 months. But just finally, for any mothers or employers who, like you mentioned, may have questions, may want to find out more information or get that certification, what's the best number or contact to reach out to?
Barb Mafna's number is 777-6526, and my number is 488-5171.
All right, well, thank you so much for joining me, ladies.
Thank you, Isa.
Stay tuned. We'll have more health, home, and lifestyle after the break.